Okay, so we're going to look at obstructive sleep apnea, and I'm going to give you some screening tools that I use to find out who might be potential sleep apnea patients. And I want you to think about people, either yourselves or people you know, that would also be considered a potential sleep apnea patient. I cannot diagnose by you filling out the forms that you have in front of you. The only way we can diagnose sleep apnea is by doing a sleep test. You can do it in a sleep lab, or I have a sleep device that you can actually take home, and you can do it in your own home, in your own bed. I actually did one with my brother who lives out of state. I sent him my sleep device. His wife was saying that he stopped breathing. That's a big concern when I hear that. So he took the test. When he got done taking the test, his wife said, and my brother said to her, you also snore and you also stop breathing. So she took the test as well, and they both turned out to have sleep apnea. So we're looking for people who we can, through dental devices, save their lives or expand their lives. Once they're diagnosed with sleep apnea, I can treat them if the condition is diagnosed by a board-certified sleep physician from the sleep test that's done on the patient, if in fact the patient shows to be mild to moderate sleep apnea. If they're severe, the physician will order a CPAP machine. Most people don't like a CPAP machine. So let's try to find some people that you might know. I gave you the list in my 1 minute of the comorbidities that are associated with obstructive sleep apnea. There's another form that you should have, a patient information form, that gives you some other related diseases that go along with it. Restless leg syndrome, nasal congestion and hay fever, depression, narcolepsy, which is you fall asleep almost uncontrollably and you go into a deep sleep, frequent nighttime urination, irregular heartbeats, and chronic fatigue. Years ago, I used to think that chronic fatigue was a result of excessive mercury, which is a problem for people in dental restoration. But come to find out that maybe the underlying root cause could be obstructive sleep apnea. Let's look at the next form, which is stated the obstructive sleep apnea screening form. It has some very significant questions that the patient fills out, one of which stands out to me, and I already alluded to it. It's, do you choke or gasp while you sleep? That means they stop breathing. And their brain at one point in time tells them, wake up. We call that an arousal. And in doing that, there's an abdominal contraction, the abdominal muscles, and it forces acid back up into the mouth, and it causes acid reflux, and it also deteriorates the teeth. It actually wears down the enamel on the teeth. At the same moment that arousal happens, the jaw muscles of closure and what we call mastication clench together, and they bang extremely hard, and they break teeth, they break fillings, they break crowns, they break bridges. So if you know or see people that have a lot of fractures in their mouth, or they talk about, my teeth are always breaking, my fillings always break, maybe that's the problem. So that's the top box. The next box says staff use only. It's what we use to do some more diagnosis through the examination we do. So think about it. What we're looking for is, how come is somebody not able to breathe because their airway is obstructive, right? So this has to be totally open for the air to come in, either through their nose or through their mouth. So if there's anything that's causing a blockage, that's a problem. And let's look at first its soft tissue way in the back. Second page, if you kind of do them together, it shows a picture of the oral cavity, the mouth. One of the soft tissues we look at is the uvula, which is that long thing that hangs down behind your tongue. If that's excessively long, that blocks the airway. If the tonsils are there and they're excessively large, that blocks the airway. If the soft palate on the roof of your mouth is excessively swollen and long, that blocks the airway. The tongue is another problem. If you look at the pictures, what it's showing you is, does the tongue, when you open or stick it out, actually open the airway, or does it fall back as these latter pictures show and block the airway? large tongue, if you ever look at yourself, probably not somebody else at a dinner table, that's not a usual dinner conversational note. But if the borders of the tongue are scalloped, what does that mean? That means the tongue doesn't have space there because it fits in between that narrow place, and it forms little grooves that are shaped just like your tongue. If the jaw is too narrow, it's an airway blockage. There are tori that develops. That's if you feel underneath your tongue, big humps in there, that's excessive bone. Yesterday I saw a fellow that had tori that almost met in the middle of his mouth under his tongue. And he had massive tori on the top. He's excessively grinding his teeth, and the body, as a result of that, lays down bone, which is what that is. The class 2 occlusion on the other page is an anatomical structure of the lower jaw related to the upper. The lower jaw is set back. So if you know somebody that has a small chin, maybe a small chin, or maybe it's because the lower jaw is protruded, causing blockage of the airway. Absolutely right. Thank you. All right. This is all covered by medical insurance. There's another page that you'll see that shows obstructive or an affidavit for intolerant to CPAP. If they've been diagnosed with a CPAP and they wear it, most people don't wear it, but for 6 months, 50% of the people. All right, the last page I want you to look at, right on the top of it, good referrals. This will classify people that clench their teeth, they have jaw pain, they have kid teeth that break, and they do the stop and bang. And you'll find me patients. It should be the very last page. Oh, yeah, some of them didn't have that. I ran out of paper and ink and what shop was treat on me. More paper. My apologies. So, here's your referral sheet. Find me some patients, please, because we can save their life by making them a oral appliance. Dr. StephenLeafe, Alpharetta Family Dental.